All right, thank you everyone for joining us. Before we get started with today's topic, we do want to acknowledge that these are very uncertain and difficult times, and our prayers are really for our nation to come to a place of peace, unity, and healing. And as the founding principle of Fundamental Roots, I do want to state that in no way, shape, or form do we support or condone any injustice, racism, violence, or inequality. And the times we offer live streams on how to more effectively bridge cultural communication is really our effort to contribute to helping us all to be educated more on the various cultural practices, cultural considerations, and how to more effectively really love your neighbor and cherish each other's differences and really enrich ourselves from growing from each other and bridging that cultural communication. Now, however, today we are not going to be focusing on cultural considerations. What we are going to be talking about is our live stream series that is focused on physician communication and helping us to better understand physicians and how to more effectively communicate with them. And so we're very grateful and very excited for our guest today. I absolutely love the bow tie, and Dr. Wilkins put on his bow tie too, so we have a bow tie live stream today. So if you have a bow tie, go put your bow tie on and give us a selfie in the feed with your bow tie. Now, no cheating, no clip-ons. This is a real tie bow tie. I've learned from Dr. Wilkins, if you find a physician who doesn't tie his own bow tie, you don't want anything to do with that physician.
Especially if he's a surgeon, right?
Especially if he's a surgeon. But we confirmed Dr. Galen Henderson did tie his own bow tie, so we're safe. We're in good hands. And we're so grateful and excited for you to join us. And I want to turn things to Dr. Wilkins to introduce Dr. Henderson to us.
Well, Hedi, thank you for that introduction and that acknowledgement. Certainly uncertain times, keeping us focused on the topic at hand. And the topic at hand today is growing and giving, as you saw. And that came from, as we do these Fundamental Roots and Friends discussions, we try to take parts of the book that we wrote, The Art of Effective Physician Communication, and we sort of pull out topics of that book. The beginning of the book talks about the 6 basic human needs. And of those 6, it's love and connection, variety, growth, significance, contribution. All right. I missed one of them in there, but we want to focus on 2 of those: is growth and contribution. And to help us do that, we have Dr. Galen Henderson. Dr. Galen Henderson is the director of Neurocritical Care and Neuroscience Intensive Care Unit and assistant professor at the Harvard Medical School in the Neurology Division. I've known Dr. Henderson for quite some time and have a great deal of respect for him. He is a fellow bow tie wearer, and I'm wearing my bow tie. He wears his more often than I do now, but I put this on today just for this conversation. So we want to welcome you, Dr. Henderson. How are you today?
Very good, Dr. Wilkins. Thank you so much for that invitation. I'm really honored to be here this afternoon.
Great. Well, we're really happy to have you here, and I know you're a busy guy, and we always appreciate people taking their time out to have these conversations with us. So what I'd like to do is just go ahead and dive right in. I mean, you've read our book, and you know about our work, and Dr. Henderson, I told you earlier, I really admire you and colleagues of mine that are like you that work so closely with young and upcoming physicians, medical students, residents, interns, junior residents, senior residents, fellows. And the one thing we've asked for you to comment on is, I know that you're very involved in teaching and publishing, as well as your clinical practice of medicine and your clinical research. Can you tell us how important is it to you that you contribute in this way? What significance does that have from a standpoint of growth, professional and personal growth, and contribution to your field? What impact does that have on you? How important?
Well, I think that's something that's incredibly important to me because, first of all, in having the opportunity to be exposed residents, and fellows is definitely an honor and a privilege. And that's something that is important to be part of that next generation of teaching physicians how to practice medicine. And, you know, we feel, or I feel as if I'm hopefully will be part of their lives at some point in the future. And for those who will go on to do really great things, I would like to say I had a little bit of something to do with that. And so it's definitely a privilege and an honor. And since I've been doing this for a little bit of time, I've seen how the educational systems have changed, and also the people themselves, what priorities are, how people interact with each other, how that affects physicians when they talk to each other, as well as how they talk to their families, the patients that they're taking care of, and the patients themselves. So I feel as if I can, that I've observed that full spectrum. And of course, having had family members in the hospital myself who are sick at times, knowing what it's like being on the other side. So I think I'm typical of many physicians, but I think I'm sensitive to those issues regarding communication and what I think makes an effective communicator. And I think the book the manuscript that you have really hits the spot in regards to pulling those individual pieces together to help facilitate that process. And I can say more later.
So one of the things I would like to follow up on that, and that's excellent the way you put that, is, you know, oftentimes, and you more so than I am actually, you're trying to reach physicians, you're trying to engage physicians, you're trying to impart knowledge to them. And as we know, you know, there's lots of things in this world that can lead to burnout, fatigue, and cynicism. What role would you say that growth, the opportunity for growth and the opportunity for contribution would have in trying to engage people? How do you use that as a hook, or do you use that as a hook?
I feel that growth in helping form the next generation, and also it challenges my knowledge base. For example, in medicine, we all know that things can change from week to week, and the way we practice medicine now, in 2 years, that might be completely wrong and considered malpractice. Staying on top of all of the data and trying to identify which sources of data or which study is the most valid study, and basing your practice on the available data, which is fluid in nature. I think it does take some skill to try to stay above the tide and keeping your nose above the water. When there are students around, fellows around, people who are constantly asking questions, that does help challenge some of our teachings, things that we have been taught. And it always makes us go back to the data to see what's new, to keep us on top of the ball, so to speak, because otherwise it's easy in this field of medicine to kind of slide behind and do things like we did back in the 70s, so to speak.
Right. I would call that, I used to talk about biddy-waddy. Have you heard me use the term biddy-waddy? BTTWADI. It's because that's the way we always did it. Right. And I know for me, a lot of times stagnation is bad, right? I mean, you don't want to feel like you're doing the same old thing. I remember when I went into medicine, one of the things I did not want is I didn't want to go to a 9-to-5 job where I got to work, I did the same thing every time. I just didn't feel like that would fulfill me at all. So I guess the one thing that you kind of mentioned is that you've got these young, eager learning minds that continue to help you grow. Hedi and I oftentimes go to different OPOs and we try to have OPO staff engage physicians, and we talk about using the 6 basic human needs. Do you ever find yourself trying to engage with a physician and using the opportunity for contribution as a hook to engage them, or the opportunity for growth to engage them? Can you think of things like that?
Right. Engagement, yes. Growth, I would say yes to both. Um, I do like reaching out to my colleagues in multiple ways. Face-to-face is always best, but even when I participate in continuing medical education courses, so I give a lot of lectures in a lot of different areas in the areas of stroke and neurocritical care. And that's another way of staying engaged and growing, and also listening to the questions of the audience. It helps me get a sense of what they're thinking, what's on their minds, how things have changed based on the questions. So I really love the discussions after a quote unquote lecture has been given, because I think I benefit more from that. And this is something that some people might hate is, how you may have one or two people in the audience who are kind of crotchety, and they're always asking kind of difficult questions, or they're being a little bit difficult. I actually like that. That actually, I think, is a good thing, and it makes me better. I think, and it makes me think about things more critically.
Interesting. I was wondering if you can say a little bit more about that, because when you're saying that, I can hear in my ear some of these Opio staff that are so frustrated with those physicians who seem to do that same thing. They come on site, and again, from the organ donation standpoint, you come on site, and it's so critical to have that physician, that neurologist, that's perhaps trying to not wanting to pronounce brain death unless the family's on board, and they're trying so hard to work with this, and they're just bringing up all these same things, like you said, being crotchety. How do you turn that into a positive, that's a challenge, as opposed to something that deflates you? That'd be great to hear.
I think in the opioid world, I tend to put things into two different categories. There is the physician-to-physician conversation. And in that conversation, when I'm talking to them, it's because there may be a question about how the person came about with a diagnosis of brain death, and we're kind of talking about things, or if there are questions that come about, how can we resolve the issue? But I am not challenging them. I try to get that I'm on their side, that I'm with them, and that we're working together for a common cause, for a common goal. I think that's very important. I acknowledge that, if it's early in the morning, that they may be tired, that it's difficult, and that the family may have, anger issues, like sometimes they do, or the family has given time limits, which is all too often. When it comes to coordinators that are in the hospital setting, dealing with families and talking to the coordinator about physician behavior in the hospital, I try to, depending on the scenario, give them some framework to how coordinators should talk to physicians, because it is different. And sometimes they do see coordinators differently. I think their structure should be much more focused, straightforward, a little bit more direct, and realizing time is limited. So whatever they may have said to a nurse in 3 minutes, they might want to figure out how to say that in 30 seconds to a physician.
I thought you were going to say 30 seconds. It's a little different time frame, isn't it? Do you have any advice for those coordinators on how to maybe use the opportunity for contribution to hook them in and engage them a little more?
Yeah, I think this might sound, I think physicians, when they're hearing the story, or, if they're being spoken to by a coordinator, the coordinator typically wants something, and the physician wants to know, why is this person bothering me? What do they must want? Why are they bothering me? And I think it's important to know how to structure a very fast presentation of what the situation is and how the physician can help. And then because whatever we're asking that physician to do, it will only just take a few minutes. It's never, to go back and check one additional thing on exam. And sometimes with coordinators, the physician will hit the roof. You want me to what? Check calorics? No, absolutely not.
That happened to you before?
That's right. And so structuring it in a way that lets them know that we're trying to cover their bases. We're on the team together, and the coordinator just presenting. And I think many of the skills for presentation that we learn in medicine probably were learned in the second or third year of medical school, when you learn how to present to your attending or your resident.
Right.
So we've gotten practice over the years, and we, I think, take it for granted. And when nurses give reports to each other, that's a much different process, and the data there is very different than what a physician would talk to another physician about. I think it would be
helpful. Very different.
Yeah.
It is very different. Yeah, I've heard you say a couple of times of coordinating, working together, getting on the same page. The other thing I heard you say was that oftentimes when a coordinator comes to a physician, they want something. Most times in the hospital setting, if somebody approaches us, they want something, and we want to know what that is right away.
Right.
I picked up on what you said about that. But, I think on the other hand of that, don't you think, from a contribution standpoint, from a physician standpoint, we kind of want to fulfill that too. If you want something from us and I can help you, I want to help you. So as soon as I can get to what it is you need, why is it that I can go ahead and help you? That's contribution, really, isn't it?
Right. And also, if one thing that might be helpful to coordinators, if the physician that they were speaking to has been part of a declaration process in the past, or procurement process in the past, or lives are saved from whatever part of the spectrum of organ donation or transplantation that they were part of, remind them and thank them for that last case that they participated with, and said, those patients, you saved 3 lives, and those patients are doing well, and this is an opportunity to save 2 more lives or 3 more lives. Because I think sometimes physicians do on the donation side, since the worlds are kind of separate, they kind of forget sometimes that, oh yeah, that's right, I will save lives, because they always feel good about that when they get the letter, weeks later, but they forget about the struggle that they gave that coordinator weeks before.
I think I resemble that remark.
Dr. Henderson, my question is two-pronged. First one is, would you say it's innate to physicians to want to contribute? Do you think that that is kind of a natural part of wanting to contribute? Or is that something that's professionally learned? And then the second part of the question is, I'm assuming that that's why physicians went into medicine, that they want to contribute. I know as a nurse, the first thing when I interviewed for nursing school was, why do you want to become a nurse? Well, I want to help people. And I'm assuming that that's probably a similar situation for physicians. Would it be a simple way, would you agree with that a simple way for potentially engaging physicians to contribute would to just simply say, Dr. Henderson, I need your help. Can you help me with this? Is that something that do you think would work well?
I think overall, yes, it would help. It would help. But I think in regards to going to medicine, people have multiple motivations. But this profession is different in several ways, because it is one of the few professions where there is service and there is scholarship. There is service to the community and to society, and there's scholarship, creating new information, improving processes that didn't exist before. And people can kind of mix those two if they like, or focus on one side or the other. I think, yes, everyone or many do want to make a contribution in one of those areas. That is important and is part of the motivation. Overall, is this something that can be learned versus or something that's natural? I think we all have met people with various skills in regards to interpersonal relations. And to some people, it comes more easily than others. It is something that can be taught or something that can be learned. People can improve upon how they interact with other physicians and staff, and they can get better. And they can get better if they want to.
If they want to.
If it is, if they realize that if this is a priority, if it's something that would truly benefit them, that motivation will come and they will get better. They will try if it's important enough.
I like that you mentioned that if they want to.
Yeah.
And, I have a hard time believing that people don't want to grow. Although I must say, sometimes growth is not comfortable. Dr. Henderson, over your time, you have certainly grown. I've grown. Would you say that growth is comfortable?
Not always. Not always. I think sometimes with growth, it can be very enjoyable, but sometimes it can be very difficult because pride can get in the way, egos can get in the way, and it makes that growth difficult. Sometimes people like being at the top of the pyramid and just feel a little bit uncomfortable being a few steps back. So it can be comfortable, it can be something enjoyable, but sometimes it can be very, very painful for people. And I think depending on the scenario, physicians have different pressures, different stressors that are happening in real time. And, these are humans who are dealing with humanity and their own lives and their own stressors at work, at home, with other family members, with society. So it can be quite varied.
I think sometimes if you're not a physician, you can lose sight of that. I think Hedi and I talk about that all the time. Do you ever encounter people who look at you and they think, oh my goodness, you're an assistant professor at Harvard and you're just this bright person, and kind of forget the humanity side of you? Have you ever experienced that?
I think I'm trying to get a better ask your question a little bit differently about the humanity side.
Have you experienced time when you're interacting with someone and you get the sense that they're looking at you as someone other than human?
Oh, sure. That does happen. That does happen. I as some type of oddity. I get that. I think there may be multiple reasons for that, but that's something I don't try to pay too much attention to, and I just try to continue to move forward and making sure that they understand what the situation is at real time and what the expectations we have for the near future. So I continue to
good advice. Yeah, good advice. Hedi, I'm sorry I cut you off. You were about to ask something.
We do have a question from the audience that I wanted to pose for you, but I also wanted to just quickly comment to what you just said, Dr. Henderson. You are also somebody who's very, very good at just being even keeled and non-reactive, at least in my experience. And so I think there's just that instant likability and connection that happens with you. So I can just see you process it probably very, very well when somebody might be coming at you differently than they should be. Somebody did pose a comment saying that a doctor also has a generic name, should just be human being.
I like that comment.
Yeah, I do too.
That's from Nicole Rottinghouse. Thank you, Nicole. So I guess one question I have is more in general for physicians. When you become a physician, are you expected to publish a certain amount in a certain period of time? Are you expected to contribute in terms of growth of future generation of either future generation or other physicians? Is there some type of expectation that you have to meet for your medical license in any way?
In regards to issues of publications and that type of growth, it does vary from academic system to academic system. And each hospital that is associated with a medical school, that medical school kind of determines the criteria that it would take to be at this level or another level. At some places, you have to publish so many times per year, or a certain quantity every 3 years or every 5 years. It does vary.
So this is, oh, sorry.
No, please.
So this is more for professorship versus if you are regular attending. If you're an attending who's not pursuing professorship, is there any requirement?
No, but I think and there are different blends of what you see at some places. They may have it as an expectation that if you are at this location, this is part of what we expect you to do, is to publish. And at other places, the rules may be a little bit different. Because here at this type of environment that I'm in, we have a lot of MDs who are just doing basic science research that could easily be transferred to any university, basic science PhD level type stuff, and who don't see patients at all. So there's a wide variety of spectrum, from MDs who don't do any clinical work to those who are more clinically oriented, but always has some type of research background.
All right, great. We do have another question from the book, Growth Overlaps with Variety, in that in order to grow, one must experience new things. What new experiences do physicians appreciate when it comes to contribution?
New things include new diagnoses. There are diagnoses that we make now that we never heard of 5 years ago. And we assumed that it existed, but we never recognized it. So there are new diagnoses. There are new treatments. And those new treatments have new side effects. And so that keeps churning. And I think the process that we use to improve upon keeps changing. The way we handle laboratory data. Now we're using artificial intelligence for certain things in radiology, pathology. We're using robots in the hospital, telemedicine. And now, in light of our current infectious issues that are happening, telemedicine has really taken off over the past couple of months or so. And so people who were not IT people are learning how to live their lives differently on the computer, interviewing patients, making different contacts, and it's growing the physicians as well as the patients in different ways. You
Mhm.
know, could I ever tell my grandmother that in a year that her doctor visits are going to be online? I mean,
Mhm.
that's just impossible for her to believe. But now
Mhm.
it's it's true. It's something that's happening.
That's
And you
what we have.
mentioned something, Galen, I wanted to put off is that we talked about contribution. It can be a contribution of a process. And it's also interesting to me when I see physicians do a complete flip. You mentioned the telemedicine. In my practice, we have been talking about doing telemedicine for years. And all of a sudden, this pandemic has come up and we're forced to. And physicians that have been in our group for years who said they would never do telemedicine, now we're getting notices from them saying how they do telemedicine, what they like about it. They're getting feedback from their patients about how much
Right.
they like not having to leave their house and come to the office. And now they're complete and total converts. And to me, it's always been fascinating, Galen, where you can, if you see that physician where you've given them that painful opportunity to grow, because going from seeing patients in the office one week to doing telemedicine the next week, there's some pain associated with
Oh,
that.
yes.
But having there is, and but having gone through that, as we talked about earlier, not all growth is comfortable. But having gone through it, now there's that feeling that you've now contributed. That it's never a good idea till it's your idea. Well, now they want to come to administration and say, "This is how I'd like to do my telemedicine visits," and so that physician has contributed, and there's a certain fulfillment to that. It's really fascinating to see.
And it sounds like, just to maybe start bringing things to a close, because we are a little over time and we want to be respectful of your time, Dr. Henderson. Um, the in terms of the audience members who work for an organ procurement organization and dealing with donation, we often talk about how the growth piece kind of ties in with that need for variety in a human being, and that while the growth is painful, we also need something different to stimulate us and to help us grow. And like you said, with telemedicine, it's a new challenge, but once you start getting the hang of it, you see the pros and cons of it, the benefits of it, as well as the downsides. And we often talk about, when we teach workshops, Dr. Wilkins and I, that donation can provide that variety and that growth opportunity, but also a great opportunity to contribute. And I think that's where the feedback loop also is really important, that, like you said right at the beginning, reminding the physician, well, remember the impact you had on this last case. You can have that impact here again, is so powerful in, one, making the physician feel like they were able to contribute, because if they don't get that feedback, then they don't know they contributed. And the variety of donation, because that's not an everyday occurrence, can challenge a physician to grow and be more educated in that area. Would you agree with that kind of summation?
I wholeheartedly agree with that. And even, this time of the year, it's typically the time for resident and fellow graduation. And part of the graduation ceremony is that we let them know how many patients that they took care of, where there was organ donation, and how many lives that they actually saved during their 3 years of neurology residency or 2 years of neurocritical care fellowship. And I think it's something that's important because after a couple of years, I said, "Wow, that's a lot of people."
Mm-hmm.
Um, I felt like I saved lives here, and they were part of the solution,
Mm-hmm.
That's
and that's
pretty powerful.
right.
Yeah.
Galen, you're somebody who I've always looked up to, and after talking with you today, it's been great that you spent this time with you. My admiration has only grown, so I really appreciate everything that you do to contribute to the next generation. I think that residents and fellows that work with you are incredibly lucky. But I'm just glad you gave us the time today. I really appreciate it, and thanks for all you do, man. Love it.
Thank you so much.
Oh no, I want
And
to thank you both. We're all in this all together, so I really appreciate the opportunity to work with you guys.
um, So, Dr. Henderson, thank you so much for all that you do in the field of neurology to help us all improve in our understanding and knowledge of brain death, and all that you do to support the donation field as well. And most of all, thank you so much for supporting this live stream and just offering your time and being part of today and lending your insights.
Great. Thank you very much.